everyone, welcome back to our part 2 video talking about pressure sores, how we can work to prevent them, and also how to conduct what we call a skin check. If you would like to review information about what pressure sores are, why it's important that we work to prevent them, the different stages of a sore, and also possible risk factors, then please go back to part 1 of this video and you can see that information there. One way that we work to prevent skin breakdown is what we call pressure relief. This is when we reposition or lift ourselves to take pressure off of those high-risk areas so that the blood can recirculate. Here I'm going to demonstrate a few ways you can complete pressure relief. To start, you can pick up your leg and cross it over the other one, holding onto the armrest and lifting up on that knee. You can lean to the side, creating space between your opposite hip and your wheelchair cushion. This takes the pressure off of that specific hip during this movement. So then we want to do that to the opposite side as well, and lean to this side to relieve the pressure. While sitting in your wheelchair, you should be doing pressure relief every 15 to 30 minutes, with each relief lasting a duration of 30 to 90 seconds. Here's another example of a technique where you drape your one arm over the side of the wheelchair, and you can push with the opposite arm, again creating space. The method and timing of pressure relief varies depending on your injury level and skin tolerance. Be sure to ask your therapist for recommendations before leaving the hospital. Not only can you do this while in your chair, you can also do this when in bed. We typically recommend that you change position every 2 to 4 hours, and you can set an alarm or a timer to help remind you for when you're laying in bed. We also recommend that you use pillows or a foam wedge to keep bony parts of your body from touching each other in the bed. Something else that goes into this is making sure that the sheet underneath of you is not wrinkled. Here's an example of how you would want the pillows positioned when you're in bed. Having one under your head, protecting your neck and the back of your skull. Have one pillow under each arm, protecting your elbows, wrists, and hands. And then also having a pillow under your heels. We don't want your heels or your feet to be sinking into the bed. We'd actually prefer that there be a pillow underneath to let the heels float up from the bed a little bit so there's not just constant pressure going down through your feet. One question you might have is, how do I know when a pressure sore is forming? So we'll teach you how to conduct what we call a skin check, either on your own, using a mirror to help, or the help of another person or caregiver. You should be checking your skin at least twice a day, and you can look for changes in skin color. Areas might be more pink, red, bluish, pale, or shiny if a pressure sore is forming. Look to see if you have any blisters, bruises, or other skin changes over bony places like your tailbone, hips, elbows, heels, ears, and ankles. This image has a good representation. All of the areas that are bonier and are more susceptible to getting a pressure sore are in that darker orange color. So you can see back of the head, shoulders, elbows, lower back, heels, and ankles. These are the target areas that you should pay extra close attention to. You should also be checking more often if your time spent sitting down or laying down has increased. While doing the skin check, wash your hands with warm soapy water or use a hand sanitizer. Start at your head and work your way down the body, moving front and back. Make sure to check any newly healed skin because that might be more sensitive and also more easily injured. Check under skin folds like under the breasts or on the stomach. Check your fingers and between your fingers. Check your finger and toenails for any rough, sharp, or ingrown nails. And for men who wear external catheters, be sure to check the penis for any sores or rashes. Other things you can do besides completing pressure relief and doing skin checks to help protect your skin include making sure that you're using a proper wheelchair cushion as recommended by your medical team. Your therapist and wheelchair vendor will perform pressure mapping on you to ensure appropriate weight distribution while seated on your wheelchair cushion. There are several different types of wheelchair cushions available to try to find the best fit for you. You can also make sure that you maintain adequate diet and hydration. You can avoid tight-fitting clothing and shoes, avoid smoking, and one of the major ones is to keep your skin dry. You can ask your nursing team or healthcare team about using different moisture barrier products on your skin that gets wet frequently from sweating or urine, such as a zinc oxide or silicone cream. Changing your bed sheets and wound dressing often to protect your skin from moisture is also a great idea. Put that moisturizing lotion on your skin too, and gently pat your skin dry with a towel. Do not rub it, just to avoid the force and pressure of the rubbing motion. If you have any incontinence with stool or urine, then just be sure to gently clean the skin up afterwards and making sure again that you're dry everywhere. Again, pressure injuries can create several medical complications, and we want to do everything we can to help prevent them. So with that, please reach out to your medical team if you have any questions or concerns.